Patient and family-centered care is embedded in our culture at UAMS. It's ingrained in our practices and making an impact on health professions' education, quality, safety, patient engagement, and patient satisfaction across our institution. Together, patients, family, doctors, nurses, therapists, administrators, students, we are making a difference.
I make an impact by making a good first impression.
Having surgery can be scary. Inviting families into the PACU can really help ease their fears. I know if it were my family, I would want the same thing.
I have this story of a 9-year-old boy who was waiting on his mother. I had operated on his mother. It was a very long procedure, took about 6 hours. And when I went out to talk to the family, the boy was so anxious. You know, is my mom okay? Is my mom okay? Wanted to see his mom. And so I said, yes, I'll take you back to PACU. He was so excited about seeing his mom, you know, give her lots of kisses. At the end of the experience, the boy told me, maybe I want to be a doctor when I grow up. And I think that was a positive experience for this young boy.
I make an impact by showing you can do lots of things after a stroke.
Hello, I'm Schwarz. When we do an eval, it's always thank you for this class. We show them just a little video of what to expect, you know, the surgery itself, and they go, oh, and it's like what they imagined in their mind about having a total knee is more complicated than when they see the film. So they feel empowered to know that I'm in charge. We tell the coach, you're in charge, you know, and you're there to help them manage their care. And so, yeah, they do feel empowered.
Well, the knowledge of the disease, me, myself, I feel, is closer to the cure than the medicine and the doctors are. Because without the knowledge of this disease, you would never beat it. And you learn foods and what you can eat and what you can't eat, your whole life is going to change.
I make a difference by making sure patients have what they need when they leave the hospital.
We do invite patients and families to call the rapid response team if they have any concerns about their family members that are here, whether it's a clinical indication or whether it's just a gut feeling that something's not right.
They've always listened. I mean, I had a incident where he's diabetic, so I was unsure. I felt like he needed to be checked. It wasn't time for his blood sugar to be checked, and I asked a nurse, and she did it immediately. We've been able to stay overnight, so somebody could be with them 24/7, which is perfect. I mean, that really helped us a lot.
So this patient made this comment in my star rating stating that he or she didn't see me scrubbing or washing my hand as I entered the room. And I think this comment absolutely changed my practice. Every time I go into the room, I just pay special attention that the patient really sees me scrubbing or washing my hand.
When I see a negative comment, instead of being bothered by it, I look at it as an opportunity to figure out why the patient wasn't happy and if there's something that I can do to help them to have better care. I want to make sure every patient has 5-star care.
I make an impact at UAMS by teaching our transporters compassion while transporting their patients.
I've had the opportunity for the past 20 years to work in critical care. I've seen us transition from a very restricted environment to now when we are inviting our families to be a part of the healthcare team. We continue to work hard in the ICU to create an environment that supports our families, our patients, our staff, and we feel like that we can accomplish this through good communication.
As we look for better ways to address pain at UAMS, patient and family involvement has been our top priority. We are working to implement patient and family center rounds to incorporate patient and family education, patient assessment, and individualized patient treatment plan.
I make an impact by engaging the patient and community voice in research.
In simulation, we often use standardized patients. These are live humans that are trained to serve in a scenario as a patient or a family member. And we have revised the way that they provide feedback to the participants. And we use the framework from patient and family-centered care, so that in the debriefing, the framework is tailored to the basic principles of patient and family-centered care.
We have now developed elements in our learning curriculum focused on patient and family-centered care, elements that incorporate concepts of patient and family-centered care as students are learning new skills or content throughout their coursework.
I make an impact by making sure that every new UAMS employee knows and understands the importance of patient and family-centered care.
I get to go home. I go home to my family. I go home to my daughter. The families and the patients up here don't get that. They're here for weeks, months, days. My philosophy is I've got to make the best out of the 12 hours I'm here. Sometimes it's just warm blankets and turning them to where they can see out their window, finding their favorite TV show, playing music for them, praying with them. Everybody's different, and it's whatever is going to work. Sometimes it's not the patient you can help, sometimes it's the families, because sometimes the patients are so sick they're asleep and they're unaware. So then you try to help out with the family members, whatever they might need.
This place touched us in ways that we could never would imagine, or, words can't say enough about this place, about the care. So my wife, Lauren White, got admitted to UAMS. She spent 5 months here at UAMS. We met some very special people here at this long stay that we had here. She got to go outside on October 1st of 2015. A very special nurse, Alisa Carlock, took her out, and it was just very special to Lauren because she hadn't been outside in a couple months, and meant a lot to her and a lot to us, and everything else that we really think it actually helped her physically and mentally too. So
I make an impact by providing the best electronic health record education possible to our staff.
Being in the hospital could be stressful for patients and families. The Compassion Card was created to help out families whenever patients are here for a long time.
We consider the family and loved ones of a patient as part of their care team, so we make every effort to include them in the decisions. The end-of-life decisions are particularly hard times, so we're always there to support the family, whatever they choose.
I make an impact by making changes that our patient advisors recommend.
The Gathering Place is a very unique place. We service a lot of different items for a lot of different reasons. We have some patients that have a hard time swallowing, so we have soft foods. We also have the icy. We also provide gluten-free options.
As my mom's caretaker and legal proxy, I have the ability to log into her MyChart, and I can see all of her medical records. I can see test results. I can see summaries of our past visits, and I can send requests for prescription refills. I can confirm appointments. They send me emails when test results are available, and so I know usually within 24 hours what the results are and can call Mom and pass those on to her. And this data is accessible 24 hours a day, and I don't have to track down information and make appointments on the phone and, depend on someone calling me back. I like it. It's easy to use.
I make an impact by keeping babies connected with their families while they are away.